Shoulder anatomy and shoulder movements. Let's start with shoulder complex joints. 1. The sternoclavicular joint. The sternoclavicular joint is a complex articulation involving the medial end of the clavicle and the clavicular fist in the sternum. The sternoclavicular joint is enclosed by a capsule, reinforced by anterior and posterior sternoclavicular ligaments. In addition, the joint is stabilized anteriorly by the sternal head of the sternocleidomastoid and posteriorly by the sternothyroid and sternohyoid muscles. The interclavicular ligament spans the jugular notch, connecting the medial end of the right and left clavicles. The costoclavicular ligament is a strong structure extending from the cartilage of the first rib to the costal tuberosity on the inferior surface of the clavicle. The articular disc separates the joint into distinct medial and lateral joint cavities. Sternoclavicular joint movements. Elevation, depression, protraction, retraction, axial rotation of the clavicle. And this movement happens when you raise your arm over the head by flexion. 2. Acromioclavicular joint. The acromioclavicular joint is the articulation between the lateral end of the clavicle and the acromia of the scapula. Tissues that stabilize the acromioclavicular joint. Superior and inferior acromioclavicular joint capsular ligaments. Coracoclavicular ligament. Articular disc. Deltoid and upper trapezius muscles. Acromioclavicular joint movements. Upward and downward rotation. Sagittal and horizontal plane rotational adjustments like protraction, elevation, retraction, and depression. 3. Scapulathoracic joint. The scapulathoracic joint is not a true joint, but rather a point of contact between the anterior surface of the scapula and the posterior lateral wall of the thoracic spine. In the anatomic position, the scapula is typically positioned between the second and the seventh rib. Scapulathoracic joint movements. Elevation and depression, protraction and retraction, upward rotation and downward rotation. 4. Glenohumeral joint. The glenohumeral joint is the articulation formed between the large convex head of a humerus and the shallow concavity of the glenoid fossa. Tissues that stabilize or deepen the glenohumeral joint: the rotator cuff muscles, long head of the biceps, coracohumeral ligament and capsular ligaments, and the glenoid labrum. The glenohumeral joint movements: flexion and extension, abduction and adduction, external and internal rotation. Thanks for watching.